Caitlin started as a bedside nurse in the VA, then became the innovation specialist at the VA in Western North Carolina in Asheville, and now is the VA Immersive Program Manager, largely running the day-to-day operations of what we get to do in this work. So with that, I'll hand it over to Caitlin.
Thanks, Anne. And it's, of course, an honor and a privilege to get to work with that lady every day as well. Thank you all for being here. Today, I'm going to talk to you a little bit about how VA Immersive has grown and also how some standardized approaches to data related to the use of this technology actually help us to better capture the value of that growth. So I'm not going to do a huge deep dive into clinical outcomes. I know many of you would probably be very excited to hear that, maybe not so much right after lunch, but probably excited to hear that. But I only have 15 minutes, so I'm going to be going through it a little bit faster than usual. I'll skip this because Anne just gave you that disclaimer again. So back in 2017, there were only a handful of folks looking at the use of immersive technology. Now, if any of you saw this slide last year at the Immersive Summit, you might notice there's actually a few more pins on it this year than there were last year. And part of that is the beauty of the network that we've developed, this community of people that are interested in or using immersive technology. Because that network keeps growing, we keep finding out about other early on use cases of immersive technology in the VA. So what used to be just a handful of folks on this slide, now we see like Edward Hines Jr. VA Hospital, where Dr. Khanna, an ophthalmologist, has actually been developing education and training content for over a decade. Had no idea until she became part of the VHA XR network. Or at VA Loma Linda, where Dr. Chow is doing work with immersive technology related to phantom limb pain. We didn't know that initially, but then we heard about it after he joined the VHA XR network. So what used to be just like 3 folks on this slide has now gone from 2 use cases up to 6, which is really exciting. We are really excited to find out that these people were already doing this work before we even knew about it. But what was just those 6 use cases and just those handful of sites has now become this. So having immersive technology in all 50 states, as well as American Samoa, Guam, and Puerto Rico at this point, and over 40 different clinical indications, which I'll show you an example of in just a moment. So back in 2022, these were our primary active use cases within the VA. Many of these are still priority areas for us as they might align with Undersecretary and VA priorities overall. They might be the most requested by our clinical staff, or it could be use cases that we still have the most evidence for. But what was that has now become this, and this is still not an all-inclusive list of how we're currently using immersive technology in the VA. And this list continues to grow what feels like daily, because we have clinicians and other employees coming directly to us saying, hey, I've identified this particular problem area in my work, in my practice. How could immersive technology potentially help me to solve that problem? So like just this past week, talking to a cardiologist in Atlanta, she tells me, well, we have a really hard time engaging with our patients when it comes to teaching them how to treat and manage their congestive heart failure. Could immersive technology provide an interesting solution that would better engage those patients so that they're truly learning the things they need to know to better manage CHF, prevent exacerbations, prevent readmissions? Well, I haven't heard of anyone doing that in the VA yet, but our response is always, okay, let's figure out a way to do it. Let's get you in touch with the people who could make it happen. So that's why that list continues to grow. We've also seen increasing employee engagement with immersive technology in the VA overall, including within our VHA Extended Reality Network, which is really our resource hub for all VA employees when it comes to the use of this technology and integrating it into the work that they do so that we are learning and developing and becoming together and not in siloed efforts. So we provide resources, we provide opportunities, and that number has gone from just 10 people in 2019 when I first started doing this work, when a few others started doing this work, to now, as Anne showed you, over 2,000 VA employees that are now engaged with the VHA XR network and looking into or already using immersive technology in the VA. Also, as Anne mentioned, we now have 4 communities of practice. So these provide an opportunity for our staff to actually communicate with one another about the technology that they're using, how they're using it, what lessons they've learned, barriers they encountered, the successes that they've had, and they get to share that amongst each other. So rather than, in a giant organization like we are, when you have 171 medical centers, it's really easy to fall into siloed approaches to how we use this technology. But by building out this network, we're trying to kind of break down those silos, break down those barriers between the different efforts. So we now have one. The first one was our general community of practice, which started in 2019, but we now have mental health in XR, employee well-being in XR, as well as XR for pain management. And Anne mentioned our now 3 hallmark events. So what was this in August of last year even? So 1,200 VA employees, 130 sites of care, 3 active collaborations, 1 national pilot became this just 1 year later. Like, we've had a really busy year, y'all. We are now at 172 sites of care, 154 VA medical centers, which I'll do the math for you. That's 90% of our VA medical centers now have immersive technology and actively using it, which is really exciting. 90%. And as Anne mentioned, we have 18 national pilots right now, and we continue to build out some of our clinical resources as well, and I'm actually going to dive more into those. So this is actually not all of our pilots right now. If you count these, this is not 18. We have more of them at the moment. You see some common themes here that kind of align with VA priorities, with our Undersecretary of Health priorities related to mental health, related to rehabilitation, suicide prevention. You also see some efforts related to substance use disorder, chronic pain management, better care of our older adult populations. And so these are just, like I said, a sampling. And I'll do the math for you again. This just on this slide is over 1,200 headsets deployed to the field for just our VA immersive national pilots. So quite a lot of headsets going out there. And these include not just our collaborative research and development agreements, not just donations, not just procurements, but really a whole sampling of all of those different methods of getting this technology into the hands of our staff. So I just wanted to point that out too. This is through multiple different pathways that we are providing this solution to VA employees. So I also mentioned our developed resources. So we have, these are just 3 of them. The first one being, I'll talk about, is the Extended Reality Playbook, which really is the step-by-step guide of, this is the problem I've identified, what kind of hardware and software do I need, how do I move through the process of actually developing out a pilot or program, so it provides staff with a starting point. It'll talk them through even the privacy considerations, OINT, all of those sort of resources, including common terminology related to the technology. And then also the Intro Guide to XR, which acts as a supplementary resource to the XR playbook. So once they've determined their problem, they're ready to move forward, they want to use immersive technology to potentially solve it, they also need to know what hardware exists on the market, what are the characteristics of that hardware, what software is currently utilized within the VA that we already have some evidence for, and even what is the pricing on that. So we provided that resource to staff as well. So once again, we're not having them recreate the wheel, we're not having them do all of the hard work themselves. We're trying to make this easy for clinical staff to integrate this technology into their work, because as we know, if we don't make this easy for our VA employees to actually integrate it, it's not going to happen. They need to feel supported. And then our most recent resource that we've developed is the Veteran and Employee Engagement Toolkit. So Anne mentioned those veteran experience events and now employee experience events. Well, we have so many people excited about holding those type of events that we developed an entire resource dedicated to showing them how to do it successfully and effectively. And so that's the newest resource we have to share. And now all of this is in addition to the other resources we develop, like standard operating procedures, competency checklist, our contraindications and precautions guides, documentation templates, all of the things that clinicians might need to actually be able to use this and document it, collect data, all of those things, we have that. Cleaning procedures. And so we develop all of those for them and try to create it at the national level so that we are kind of standardizing the guidance that we provide as well. Whoops. Now, I mentioned national documentation templates. So some of you may not know what a health factor is. Some of you definitely do. And I'm going to tell you this slide is really, really exciting to me. To some, it probably is like, oh, that looks like a bunch of data gibberish. So one of the things we worked hard to do was create national virtual reality health factors for general use. So we have one for their first virtual reality session and any subsequent virtual reality session. What that means is this health factor can be added to any clinical encounter. You know, when they're entering their CPT codes, that sort of thing, they can add these health factors to that documentation. Or they can be embedded in any clinical documentation template. So if you have a clinician respond to a very basic question, is this the first VR session with the patient, or a subsequent, or a final, it can associate a specific health factor with that response. What that means is that now, as of the start of last year, we can actually start tracking virtual reality use across the entire country. So this is just the visits and patients that have been since early last year and only part of our national pilots, the ones that I was able to develop standardized templates for. So this by no means encompasses all of the VR use within the VA, but I want you to see the importance of how this standardized method of data collection allows us to truly see the value of integrating this technology in the work that we do, because now you can tell that there have been over 1,500 virtual reality sessions completed across the VA since we developed those health factors. There have been over 1,000 patients impacted by virtual reality. And now, while this dashboard, which I hope Hugh is watching, because Hugh from CCBI helped us build this dashboard, and thank you, Hugh, because when he showed me this, it truly made my year. But you know, we're also working with him to start looking at more patient-level outcomes. So not only can it show me the number of visits, the number of patients impacted, but it has the potential to show me how this is impacting patients at a local level, VISN level, national level, or even at an individual patient level. So it has that potential, because not only do we have these national VR health factors, I also create health factors for every single note template that I develop on the national level. Every response to a patient objective assessment or patient-reported outcome measure has a health factor embedded that we then share between sites for different use cases, different service lines that allow us to capture this information. Now, I know, exciting stuff. Now, what I'm hoping this does, because anyone that knows me knows that I talk about health factors and templates all the time. It's exciting to me, but now I hope you can see it. This is why it's exciting to me, because then we get to see the impact and not just talk about it. So I'm hoping for all of you, especially virtually and here, that are in the VA and you're using this technology with your patients, I hope this gives you the incentive you need to start embedding these health factors into your encounters, into your documentation. Hopefully we're creating a little bit of healthy competition too, because you can tell on this slide which sites are using it more often. You know, make your circle bigger. And I want to point out that's where Ann and I are from. So what those health factors also do is let us know about our individual pilots too, like how are patients actually engaging with our individual pilots. So as an example, our VISN 4 CLC pilot at 9 sites. Through health factors, I'm able to tell that 171 unique veterans have completed virtual reality sessions, over 350 sessions amongst those. It also lets me know that even since March of this year, in that single pilot, those numbers have quadrupled since March. Also, chronic pain applied VR. So not only just looking at health factors, but how do we standardize documentation collection and other templates to allow us to better understand how patients are using this technology at home. So we know for sure that chronic pain applied VR pilot, we have 14 sites, and in 3 months, 250 veterans, unique veterans, were enrolled in that pilot in 3 months. And they have now completed at home independently over 3,800 sessions that we are aware of, which is a lot. for the chronic pain and suicide prevention pilot, 60 sites. I know through standardized documentation templates that over 130 unique veterans have already been impacted by that pilot. And that's before I even got the national documentation template ready. This is just through temporary documentation tools that I developed. And over 300 sessions have been completed, and that's just been since late January. What health factors also allow us to do, as I said, is look at patient-level outcome as well, clinical outcomes. So as an example, the VISN 4 CLC pilot, and this is 9 CLCs or community living centers in VISN 4, we can tell through those health factors that there's an average 60% decrease in distress, significant decreases in agitation, anxiety, restlessness. And when I'm talking about agitation and restlessness, I'm typically talking about our patients with cognitive impairment that may have those sort of behaviors that we're trying to hopefully decrease without the use of pharmaceuticals. So that's pretty significant. And looking at, of course, just a decrease in boredom, or maybe it's a decrease in loneliness and social isolation. So it's amazing what those health factors can tell us about an overall population and an entire VISN of the VA. So like I said, I'm not going to talk a whole lot about all of the rest of the patient-level outcomes, but what I did want to highlight was some of our patient experience data. So through health factors, I can actually find all the responses to these as well. So we created this survey to be used for our veteran experience events, and we liked it so much we decided we were going to add it to every single documentation template that we create for all of our pilots, so that we're collecting the same patient experience data across the entire VA. So based on the responses we received so far, and just only in our national pilots that I've developed templates for, we've seen responses like this. So out of 101 veterans, we have 67% of them saying that virtual reality was either easy or very easy to use. It's a pretty large percentage. And that's a pretty good sized N for that response. And also, if you had the need in the future, how likely are you to prefer virtual reality as part of your treatment or your care? So we have a very high percentage saying likely or very likely. We've got 99%. How likely are you to recommend use of VR to your fellow veterans? Also very high. We've seen 95% saying likely or very likely. On a scale of 1 to 10, with 1 being terrible, 10 being life-changing, the average experience rating was 8.27 out of 98 responses. And if you had a VR headset at home, would you like to use it for your wellness and or healthcare? And this is an important one because we've definitely been pushing more into the at-home setting to really extend the reach of our hospitals, to extend the reach of VA healthcare. 90% would like to use this at home for their well-being, for their healthcare. And I think we're going to see a lot more of that as we start to increase the number of use cases using it at home. And this is always one of my favorite slides. These are actual veteran quotes about their experience in virtual reality in particular. We collect these for all of our pilots. I recommend all sites using immersive technology to collect candid remarks from the patients about their experience for this reason. Because I can show you all of those numbers all day long, but these comments often speak louder than those numbers could. So I just added this one recently. Using VR last week seemed to decrease my quickness to anger. I was reading one from some feedback we received from a current CRADA where it said, "This made me feel better than I have in weeks." You know, those are the kind of comments that we get from our patients. So I just wanted to highlight some of those because this is really about seeing it from their perspective and in their own words, how this technology is valuable to them. So what's next? Well, I think many of you have heard us say this already. We definitely want to increase our rigor in our evaluation. So we're very happy to be partnering with like the Office of Research and Development to be able to do so. We've definitely learned a whole lot from our ability to use clinical implementation with our patients. But we also recognize that now that we have successfully clinically implemented, we also need to have that rigor to add to the evidence for certain use cases that still need some additional evidence. So like for example, for our chronic pain and suicide prevention pilot, 60 sites across the country. We're partnering with the Researcher, Evaluator, and Residence program to do some more evaluation on that pilot in particular, related to the patient-level outcomes, related to the clinician and veteran experience. So we're really excited to see what comes out of that. We're also working with the Office of Research and Development through Query, the rapid response team, to do an evaluation of our at-home chronic pain pilot. And then we have various types of evidence synthesis ongoing with the Office of Research and Development as well. And then, of course, focusing on standardization of those data collection pathways, the documentation templates. How do we create interoperability to actually pull that data into the VA health system? Things that we're already working on and will continue to do, because we know that that is the best way to create sustainment. And then, of course, expanding use for education and training. We know that that's also an expanding field. I get requests for that constantly, so we'll be working on that too. And then, of course, lastly, heads and headsets. As we all know from being here, that is the best way to understand this technology. Thank you.